Yes, so thank you for the invitation. It's really a pleasure to be here and talking about what we do. So, my vision is to reverse engineer the doctor's mind so that we can significantly scale up access to care. I'm Dr. Anirban Mukhopadhyay, originally from India. I did my PhD in United States. Then I moved to Europe. So for the last decade or so, I have been living across three different continents. For the last 5 years or so, I'm leading a research group on medical AI in TU Darmstadt, Germany. Yeah, thanks really for the question because this is at the core of many projects that we do. So there is really a significant shortage of healthcare workers globally, and especially for Africa, for example, there are countries where you don't find a certain type of specialist for an entire country. Now, if we think of the fact that there is all pervasive mobile networks, and with the rise of AI, deep learning, machine learning of the modern form, it's not really difficult to believe that if we can combine these two in a secure, safe manner, then image based diagnosis, telehealth can be achieved at a scale which is really, really significant compared to anything we have seen before. And it's not really that there is an alternative to it. I mean, if you just think of the current way in which we teach healthcare professionals, um, it would be really hard to think that such training will scale up to meet the need of the developing world like India or the Southeast Asia or the Africa. And that really means we need to bring technology for making sure that majority of the people living in such areas are still getting access to quality healthcare. That's a that's an excellent question, and I mean, if you just think about it, trust is right at the center of patient-doctor relationship, right? Because the patients are going to the doctor, and the doctors are suggesting changes that might be really altering big things for their lifestyle. So that trust has to be there when AI also is coming into play. But I would like to think that the sort of surgical AI we develop is really about augmenting the human capability, be it planning the surgery or coming up with high precision navigation when you are going into certain type of surgeries like neurosurgery, for example, or even remote telesurgery. Our goal is not to replace the surgeon in any way. What our goal is to make sure the surgeon is more efficient while ensuring patient safety and also access to such procedures. Even somewhere like Europe, when you are thinking about the rural areas, there are peer-reviewed papers that has shown that beyond rudimentary procedures, there is not much access of surgical care in rural areas. So we can always think of how we can bring AI and surgical robotics and networks together to actually see that these people are getting access to quality care without the logistics of leaving their work, their life behind and coming to a city center, for example. I don't envision fully autonomous surgery in a realistic time frame. Really an interesting question that is also very nuanced. So basically, healthcare is intensely human procedure, right? And how humans trust technology depends a lot on their societal background, societal context. So, for example, in India, if you go to ophthalmologist to get your eye, so basically just to check your eye and see if the power is fine, I have seen patients who insist on using computational procedure to measure their eye power, even though the ophthalmologist is fully capable of doing it on her or his own. So how patients like to see technology being implemented in association with the doctor is different from society to society. I would say, fortunately, for the people who need the most in terms of access to care, they already have put a certain amount of trust in technology simply because technology reached them way before people did. So that's in a way fortunate. Of course, at the same time, there is the problem that all pervasive mobile networks and technology doesn't really necessarily mean that there is digital literacy about the healthcare that you can access, and what they should be aware of in terms of data privacy, data protection, all these things. So I would say, at least for the global audience, when we are building the technology, it should come hand in hand with literacy, public health framework that brings these two together, not really two separate endeavors. And that probably is the best way to go about it. Yeah, I mean, if we are just thinking about the population of India, a significant number of young people are coming into the forefront, and they will be leading, I guess, the next decade or so of the technical development. Now, in terms of the technical awareness, the basic analytical skills, coding, if you think of those, we have a big workforce right there. The problem though is, just if we are thinking of how we grew up in India, there has always been a divide of either you go to medical or we go to engineering, and as if these are two different worlds who should never somehow talk to each other. Now, I think that's probably where we should make the major effort into engaging into sort of dialogues between these two separate worlds. These conversations are really helpful because healthcare, especially in an environment as strained as in India, they have to go through a lot of certain workflows in a very sort of somewhat meticulously planned in the middle of a really chaotic environment. And they are taking certain decisions based on certain heuristics, certain assumptions, acquired knowledge, which the engineers don't have much idea of. So typically what we end up with is that engineers who solve sort of the questions that they like to solve without even understanding the healthcare situation. So in that regard, I do have a podcast called AI Ready Healthcare, and this is one of the thing was basically bringing such conversations to the forefront. And in one of the interviews I had was with Anant Madhavushy, and Anant made a great point that he is trained as a biomedical engineer, and he currently is one of the superstars of the field of engineering, oncology, all this stuff. And he said to me that he takes it as a compliment if he can pass by as an oncologist, if at the end of his presentation somebody comes up and asks him, where do you practice oncology? I think that's really something that we should all aspire about. To solve the problems, let's first understand the domain for which we are working on. The technical knowledge is always there, but that conversation dialogue is probably missing. This is something that I have been actually thinking about for some time, and I guess one of the way we can think about the way that AI and medical came into contact, at least in the modern sense, is sort of with that Geoff Hinton remark that radiologists are coyotes, etc. That sort of created a rather wrong assumption about what the technology is and what benefit can it bring. Now, that basically sort of exacerbated in a very weird way during the early days of pandemic, where people published papers left and right about AI and how things work there. So, but right now, I guess the major transition I see is that from AI first, we are shifting towards the clinical workflow first. So the healthcare problem and a technology solution. AI is a part of that technology, a big pipeline of what the doctors, the radiologists, pathologists, oncologists gonna be using in their final decision making. And if that shift happens, then the biggest thing that happens with it is that once you see that, okay, so this is not the magic bullet, but a small part of a big technology, then it comes to actually much more about validation in an environment. This is as similar to the clinic rather than developing new algorithms of fancy things. So I would say that would be the major change in terms of trend of how AI gonna be developing in the coming years.